Are you struggling with bloating, nausea, or unpredictable bathroom trips? Most people blame their diet. The real hidden cause could be in your gut. I'm going to give you 5 tips that could be causing your upset stomach. Let's fix it fast with 5 easy tips to restore balance to your gut. Hi, my name is Dr. Anne-Marie Barter. I'm a functional medicine doctor and chiropractor. I've helped thousands of women regain their gut and hormone health naturally. Tip number 1, low good bacteria. One of the most common causes of an upset stomach is low beneficial bacteria. Stress, antibiotics, poor sleep, processed foods, they all lower your beneficial bacteria. When this happens, the bad bacteria take over. This imbalance triggers bloating, nausea, constipation, diarrhea, and inflammation. Tip number 2, pair your foods correctly. Blood sugar spikes can trigger bloating, nausea, or an upset stomach. Start meals with protein and fiber to lessen blood sugar spikes so that the bad bacteria can be kept at bay. Tip number 3, identify triggers that could be causing your gut to become more upset. The most common triggers are gluten, dairy, artificial flavorings, seed oils, and eating late at night. I generally don't recommend eliminating anything off the bat. I would just recommend keeping a food journal and seeing if it's consistent with certain things. The other thing that I notice is when people eat higher fat meals, sometimes they're going to notice more issues where they'll blame it on gluten or dairy. And it might be that, or it could be that they had something that was fried. So just notice what the patterns are. Is it with higher carbohydrate meals? Is it with higher fat meals? Is it always with dairy? Is it always with gluten? See what is the trigger, because for everyone, it's different. Support your digestive enzymes. A lot of people think they have too much stomach acid. A lot of people have too little. And if you don't have enough stomach acid, you can't properly break down your food, which means that bacteria gets into your small intestines, parasites get into your small intestines. You also have pieces of food that are larger that create inflammation and can contribute to a leaky gut because you're not breaking down your food properly. And then you also could be that you're not breaking down your carbs from your pancreas, or also breaking down the fat from your gallbladder. So any of those things can be a mess. I generally see problems all the way through, both with low stomach acid, not enough bile, and not enough ability to break down your carbohydrates. So I work on all of those things in tandem so you can get your nutrition from your food. Tip number 5, check for bacterial overgrowth. It is so common. Most people have this issue where they have bad bacteria that's overgrown, that's causing an upset stomach, nausea. They're not digesting their nutrients appropriately, so they start to get nutrient deficient, and then that can lead into a feedback loop of not being able to digest your food very well. What I generally use for bacterial overgrowth is something called Microbe Support. I have people start with 1 per day. They can do 1 in the morning and 1 in the evening. Go through 2 bottles, and then I start to really rebuild the gut and see if that helps with the upset stomach. But it's a pretty common cause on why someone's stomach is upset.